business development, NDIS transition and executive leadership roles. He is driven by his interest in the intersection of stable housing and positive mental health, well-being and social inclusion. He is a passionate believer in stable housing being not just a human right, but good healthcare. This commitment has driven Mark's influence of the growth of Mind's wholly owned subsidiary, the Mind Haven Foundation, one of Australia's leading specialist mental health community housing providers. Please welcome Mark to the stage. I'm excited about this talk because I've seen a few of these. They're actually quite awesome to go and see. So I had the chance of of visiting Victoria and seeing a few, which was wonderful, and got to meet Mark in a few times. So Mark, we've had a check-in question, and so I know some of our speakers, especially my, I don't know if Anthony Harris, is he in the room yet? Oh, there you are. There's a check-in question you've got to remember for later. So this is about being present, so we hear a bit about yourself, but the check-in question is, what is something that you enjoyed building or creating as a child or adult? So mine earlier was Lego, and I've got my sunflower Legos over here. You can see them, they're beautiful.
They are very beautiful.
Yeah, you've got some children, but I also know, tell us, is there something that...
Yeah, absolutely. Play-Doh was my thing growing up, and is certainly my thing with my kids as well. And it might sound like a cliche, but building houses, I used to love building houses as a little kid. I genuinely believe that. I'm not just saying that.
Oh, fantastic. With Play-Doh though, are they really stable foundations, and would they meet code?
Not at all, no. Not at all. They would fall down within a matter of seconds, Kathy.
I didn't see, well, I think Play-Doh's a really cool thing because I think it's quite tactile and it's really good stuff to do. So thank you for coming to share with us about Havens. I hope you all got to listen in to what he's got to say. Remember, Slido, you can put your question in there. We're going to have questions afterwards. And for those online, we've got questions in the chat. So I'll hand it over to you. I think you just used the... Oh, you've
got a clicker. So I like to wander around a little bit. Thanks so much, Kathy, and I'm really pleased to be here, and it was great to be invited by One Door to come and talk to you about Mind Australia and the Haven Foundation. So for those of you who may not be aware, Mind is a community managed mental health organisation, very similar to One Door, and as Kathy talked about just before lunch, we're also a part of the Australian Psychosocial Alliance. We operate in Victoria, South Australia, WA and in Queensland. We have just over 1,000 staff. Over 50% of our staff also have a lived experience of mental ill health. And we do a whole range of different services, services that are in partnership with the local health district, services that are NDIS funded in housing, a lot of subacute services as well, and homelessness services as well. So there's a few stats up there that I won't go through. But what Kathy talked about within my introduction, and what I really want to talk to you about today, is the Haven Foundation. And the Haven Foundation has been around since 2006. We are a nationally registered community health housing organisation, and we specialise only in providing long-term specialist support and social housing to people living with mental health issues. Our current chair at Mind Australia is Professor Alan Fells, and Alan, along with his late wife and a number of other friends, set up the Haven Foundation because they all had children who lived with significant mental health issues. That aspect of the model is really fundamental to the Haven model and the work that we do with Mind. And part of that work is that we have a partnership with the NDIS, and we support people who live on their own, in their own individual unit, to be able to access that shared 24/7 support to keep people well and to keep people, importantly, out of hospital as well. So our model has a really strong focus on capacity building. There's a lot of work that we've been doing with the NDIS and will continue to do as this NDIS review comes about. We've been doing a huge amount of advocacy with the NDIS to ensure that that important funding for people with a psychosocial disability can continue to access that support to keep people well and to keep people to sustain their tenancies as well. Another big part of our model is peer workers. So within each of our Haven residences, we have peer workers that help people participate in peer learning workshops, intentional peer support as well, but really to help people to work on their goals of recovery and to be able to get back into employment or just to be able to maintain wellness within their community on their terms as well. I think importantly, with this cohort of people that we support, we often find that people may be stepping down out of a clinical mental health unit. We support people that may have been experiencing long-term homelessness or at risk of homelessness, and also people that may be living with parents that might be aging, where it might not be appropriate or often not sustainable for people to be able to continue to live in those situations as well. Part of the tricky aspect of the NDIS, which I'm sure everybody within this room would probably be able to relate to in some form or another, of being a participant or a family or carer or knowing somebody or being a provider, is really ensuring that the NDIS can operate and support people in a way that's very recovery oriented focused. We do have a recovery framework within the NDIS, but it's still really challenging to ensure that people who can be funded with that support within their home can actually ensure that that funding encapsulates the importance of that skilled workforce to help people on a day-to-day basis with their recovery. So we do a huge amount of investment with our staff at Mind to ensure that all of our staff are very well trained in being able to support people to make their choices, in being able to access different services that they want, and also helping people to access other NDIS services. So our model is based on a sort of like a cooperative model, is what I like to sort of term, because typically we have around 14 to 16 people who are all within their individual self-contained apartments. All those apartments have their own outdoor area, but they also have access to a significant shared community living space and staff on site as well. So people generally pool their NDIS dollars that might be supported independent living or flexible core supports to then be able to fund Mind to be able to provide that 24/7 support. So it seems to be very cost effective for a lot of people because they have a lot more other NDIS dollars to left over to be able to spend on other parts of their plan as well. Just generally with community housing, residents pay 30% of their disability support pension and then Commonwealth rent assistance as well. Now this is, I'll talk a little bit about where the amount of haven residences that we have in some of our plans that are coming up, but we really take a lot of time and consideration to understand a community before we actually think about trying to apply for funding to the state government to get funding for a haven. We really take into consideration what that current amount of social housing is within a particular area to make sure that there is a need, that there's not a high density of social housing, as well as really understanding, based on data that is available through the NDIS website, is how many people with a psychosocial disability who are on the NDIS might be living within that region, and also what the general package sizes might be. Mind have a strong commitment to working with First Nations people as well, and within the establishment of a haven, we'll work with the local Aboriginal community controlled organisations as well. An example in Mooroopna, which is a small town just outside of Shepparton within Victoria, where we have a haven residence. There's 30% of our residents there are First Nations people. Shepparton is outside of Melbourne has the highest concentration of First Nations people within the Yorta Yorta community. So it's a huge part of us being able to actually engage with community in ensuring that First Nations people can be supported and have that access as well. The actual location of when we build a residence is really important. Walking distance, mainly at the front where public transport may be, close to health services, close to local shops. The one that we have up in front is a example of a site in North Bendigo for people that might know that area, and that's a haven that we're actually building at the moment that's going to be open in a couple of months' time. So this sort of approach, we take that approach for all the areas that we recognise that there is a need, because that's, I guess, a really important part for the community, and also to ensure that the funding can actually be granted as well. Now, probably my favourite part of talking about the Haven Foundation and our model is being able to talk about the impact that it actually has on a day-to-day basis. This is Sean. Sean is a really proud Wathaurong man. He lives in Geelong. He has been utilising clinical mental health services on a very regular basis for a very long time. Part of, I guess, the work that we had done with Sean and just putting up there, I guess, that reduction in reliance on hospitalisations and emergency services was such a great achievement for Sean, because it was extraordinarily disruptive for him and his recovery, going in and out of hospital, ending up at the emergency department, not being supported adequately. But a big part of, I guess, the safety net of the Haven residents is that 24/7 support. So if somebody is not feeling too well, if they need that support, then they are able to call on staff to be able to provide that support and to be able to provide any techniques to ensure that a hospitalisation doesn't occur. I don't know why Sean wants to do this, because I certainly wouldn't, but I don't really like heights that much, so that's probably why. But he has this dream, and I think it's booked in. He's going to be going on a helicopter trip over the Great Ocean Road in a couple of weeks' time, and it's been a long life dream of his to be able to do that. And the stability and the support that he's sort of received through Haven, and importantly, that stable housing that he has not had for decades, has just actually helped him to be able to focus on the important things within life and being able to do things that he wants to do. So I look forward to seeing some photos when he comes back from that. We are working with La Trobe University at the moment. They are doing a 5-year evaluation of the Haven model. We're into the fourth of the 5th year evaluation. That's based off 5 Haven residences that we operate as of today. There's some really exciting early signs that we are seeing as a result of that evaluation, some that we weren't even really expecting as well. But some of the most exciting ones is really seeing a reduction in hospitalisations. But we're also seeing a significant reduction on people not needing to use physical health services, so not needing to go to hospital because of some physical health ailments. So a lot of that comorbidity that people are experiencing, we're actually seeing people's physical health increasing. It's no surprises in some respects, because if having access to your own kitchen, having staff there to be able to help you plan and to cook healthy meals, I think is being a big part of that, as well as being able to have that support to access your GP as well. And a big part also is that increased engagement with family as well. So although the family and carer engagement is a really big part of our model, we often have people that come to us saying, look, I don't have any family and carers at the moment. I've got no friends, but that's a big issue. And what I need is that stable housing, because that's a goal. I do want to reach out to my brother. I do want to reach out to my mum, who I haven't spoken to in a very long time. So that's a really nice thing that we're seeing as part of the evaluation around interviews that we're doing with individuals as well as families and carers as well. This is just some, for the data nerds in the audience, just some information just showing you that quantitative change around what that reduction in hospitalisations are based on 12 months before somebody was living at a Haven, and then afterwards as well. So you really can see that graph on your right, the average days in hospital for Haven residents before and after, 10 days on average, and then that going down to 5.6 days. So it's a pretty dramatic reduction, and also it actually is a good cost saving for the state government as well. So at the moment, we have had a lot of support from the Victorian and the South Australian government, and more recently the New South Wales government in the Haven model. We have 96 that we are currently building across, well, that we currently have across Victoria. At the moment, which it always scares me because I have to be responsible for this in some ways, is that we're opening 5 Havens this year. So we're currently looking for 78 people to be able to move into 5 Havens this year, and then there'll be a further 3 next year as well. But really exciting is what Kathy had mentioned as part of the New South Wales Labor Party's state election commitment is that after a very long time of advocating and some tireless lobbying, we've been able to ensure that we can have some funding to establish a haven or 3 havens within New South Wales. I do want to do a shout out to Jill, to Joss and Neil Murphy, who are with us today. Joss and Neil, if you want to raise your hand. Joss and Neil have been advocating and lobbying for this for probably around 11 years, and we've come on the tail end to really help support Joss and Neil and home on the Central Coast. So I really want to get everyone to give Joss and Neil a massive round of applause. Because without that tireless advocacy that's been going on, and I get really excited and I feel a lot about this because it's so amazing that the advocacy that's been happening within the community for such a long period of time, and this would not have been able to occur without that tireless, incredible advocacy. So it's really exciting that that is happening. First one is going to be on the Central Coast. This advocacy was happening long before COVID, but COVID has massively compounded the issues on the Central Coast. You can see up there that to be on the public housing wait list, it's 5 to 10 years for a 1-bedroom studio apartment, and the data to be able to demonstrate the need for people with a psychosocial disability, it's higher proportionally. There's 881 out of 9,747 NDIS participants as a whole that are on the NDIS who have a psychosocial disability as well. The rental vacancy rate in the Central Coast is also around 1.3%. So it's really hard to find stable housing. So that's why Central Coast is first, and we'll be working with the government to look at what other areas as well. I was speaking to Jack during lunch from the Southwest Local Health District, and very clear all across different situations within Sydney there's a need, but because of the diversity of Southwest Local Health District, we will wait and see what comes of that as well. But very exciting for New South Wales. Now that's the end of the presentation. I've got a very short video, if we can work it out, to be able to play, just to give you a bit of a walkthrough as to what a haven looks like. If tech is my friend today. No? Oh, okay. All right. I'll send it out in some way or form. My email address is there. So if you are interested, drop us an email. I'll send you a link, or easily you can just go onto the Mind Australia website and you can find out and take yourself on a virtual tour of a haven residence. But thank you so much for having me. Thank you.
Come and sit down, and we'll just need a lovely mic. You can have a glass of water and stuff. I'm sure there's a lot of people in the room who'd be wanting to hear. It was great that you had an example from a person who's living there. I know when I met around, the residents were very positive about the impact that it made for them. They felt it was their first chance to have their own place and yet have the supports. And I must say, visiting it, I'd live there. They're very nice, very, very nice. So what do you think, just anecdotally, has been the experience of people living with a mental illness coming into the havens and experiencing something like that for the first time? I'm a bit outgoing.
The level of pride that people have, that opportunity where most people are like, there's no way that I'm ever going to be able to move into something that's brand new. That's been a huge part of that. We haven't been in a situation where anybody has been evicted. That I think is sort of counts for a lot as well. I think that the level of house pride, and even probably importantly, even defaulting on rent, like people love being there and they want to be able to stay there as well. I think secondly, Kathy, that point of community. We work really hard to create a strong peer learning community. And we've done a lot of evaluation around the design of the property, and we've sort of landed on like 12, 14 or 16. And largely what a lot of that feedback is that people have said, well, 15, 16 is a good amount of people, because if I don't like someone or if I'm not getting along, there's plenty of other people to actually hang out with as well. So that's, we've taken that on board, which has been good.
Now, there has been some comments about, are we going back with the Haven model into institutionalisation? So I'm sure this is probably the first time this kind of question has been posed to you. I've, as an advocate, said, no, I don't see that happening. But what's Mind's take in terms of, I guess you're placing people with psychosocial disability in one place, all those kind of things, even though it's gorgeous and all those kind of things. What's your response around that in terms of saying it's not? And
Look, that has come about. I think that where we see it to be not institutionalized is that people have people don't need to hang out with other people if they don't want to. You have your own outdoor area, you have your own kitchen, living room, bathroom, you can be in your unit whenever you want as well. And a big part of our model as well is that we really want people to get the most out of their NDIS plan. We want people to be able to not have support coordination with Mind. We don't want people to have really any other services with Mind. If they choose to, that is fine. But where we really want people to, and what we see within the demand, is people see that having that access to shared 24/7 support is really important for them to be able to stay safe and to be able to stay out of hospital. And they see that there's no way that that would be affordable if not being able to pool your dollars with other people to be able to pay for that as well.
One of the questions online is, for how many residents is it a home for life, and how many is it a temporary place before they move on?
Yeah, great question. It's social housing, so if need be, it can be a home for life. Although this financial year, we've had 4 people move out, and they've moved out into more independent living. So we've had a lot of people, and the goal is, some people understandably will likely need to stay there for a long period of time because they want to. But there's a number of people who have built relationships, have moved into other social housing because they recognise over time that intensity of having staff there all the time isn't necessary for their mental health needs as well.
Now, I'm just going to, before I ask the next question, just if you've got a question for Mark, just stick up your hands and we'll get fantastic out the back there. I'll get it, I think that was Leslie out the back. Okay, so I'm interested. So the state government has, did as part of their election promise. I'm sure you're trying to get an answer from the state government about, okay, you're going to put your money where your mouth is. The first one, I'm assuming, will be in the Central Coast, and great lobbying and advocacy there. But what have you heard from the state government? What are you able to talk to us about, kind of how long we're thinking, when are we going to start seeing some turf being, dug up? What have you heard?
Look, I was up here to be able to meet with Minister Jackson as well, but that unfortunately, same with the symposium, wasn't able to happen in person. So unfortunately don't have that news yet, Kathy. I'm coming back up with our CEO, Jill Callister, next week, and should be able to find out. I think that we are putting it, and have been putting, a lot of pressure on the New South Wales Labor government because the need is really significant. And because at the moment we have great architectural designs that have been co-designed with people who are currently living within a haven, and we are able to go from, turning soil to actually operationalising within 18 months. So the sooner that they can actually help us to actually start this process, the better.
Yeah, fantastic. All right, let's start the questions from the floor. We've got one here, and the next one over here, Leslie, and then some great questions. Fantastic. Make it a question, Leslie.
Mark, I'm loving this idea. We did have a similar facility that was funded by Western Sydney Health, which was started in the 1980s, called CHIPS, which is a community housing implementation program. I'm just wondering, Are we talking about creating these havens that are associated with major teaching hospitals, even though we don't want to go the clinical model, but there are clients that seem to be coming out of these facilities that are doing a ricochet effect of back and forwards, and is this a way of actually giving them some stability which they can't maintain with housing, being in individual housing themselves?
So we worked quite closely with the Central Coast Local Health District. So Dr. Anthony Critchley, the ED up there, was really supportive of that. But that is one referral source out of people that have been long stayers within hospital. I'm very aware of the Pathways to Community Living initiative that is starting to operationalise now within New South Wales. And that, I think, is a really, really important program within itself. But we do, as part of the model, and even the governance around how we set up that assurance within that relationship with the local health district, that we can ensure that if people really do need that clinical support, that we can have a relationship there to be able to support them back into hospital if need be. Just because that relationship is still really important, and that stat that I showed earlier, like we know that people will require levels of hospitalisation, but we know the longer people stay within hospital, the more institutionalised people can become as well, and how harder it can be to actually come back out of hospital into a type of program with less support as well. I hope that answers the question.
Hi. Yeah, I was wondering if the Central Coast location and the New South Wales locations will have peer workers, because I think I read that Victoria has peer workers at theirs.
Yeah, 100%. That is completely a big part of our model around ensuring that we don't just have one peer worker, because we recognise that can be quite isolating for peer workers as well, but we have 2 peer workers. Part of what we are also doing with the NDIS is supporting people to be able to access some capacity building within their plan to be able to do that work with peer workers. So yeah, peer workers within that workforce will absolutely be part of it.
Hello, my question's about the overlap between psychosocial disability and physical disability. Are there provisions in the
Units,
model
yeah.
for changes to home modifications? Is that something that's looked at, can be looked at? Yeah.
Absolutely. We are not funded for specialist disability accommodation, largely because, and I totally don't agree with this, but the NDIS doesn't recognise psychosocial disability around eligibility for SDA. Some people might get improved livability, but what we have been able to do is, which I think is almost as good a lot of the time, is get people to use capital supports within their plan, so assistive technology to be able to help them on a day-to-day basis as well. Just with the Australian Building Code, we have at least 2 of the 14 or 16 units that actually are accessible for somebody who might need to use a wheelchair. And that means that the units are much larger, we have accessible bathrooms, so we can support at least 2 people that might actually have a physical disability where they might need a larger space as well.
Yeah, a couple more. Steph here first, and then was there one at the back? No? No? Yeah. Thanks, Stephanie.
Hi, Mark. Been a great fan of the model forever, and particularly that strength of connection within the residences. Can you talk to us about what you do about building their connection to their wider community? Because there's been some lovely examples from Geelong, at least.
Thanks, Steph, and good to see you. Look, there is a huge level of importance of connection with community. And that, I guess, is why when we build a haven, we make it really much in the middle of that community as well. We do a lot of work around, which is unfortunate that we still have to do this, but demystifying stigma within the community. So I go around and we'll do a letterbox drop, and then a week later I'll door knock and then talk to people around, how do you feel about this haven residence? And sometimes you'll get some pretty obnoxious responses, but a lot of the time it's around being able to educate people around that as well. So part of, I guess, outside of that very local neighbourhood community, we support people to be able to access their disability employment services if they want to, local neighbourhood houses as well. And where we're able to probably see a lot more of that happening is because people do have more funds left over within their NDIS plan, so they can purchase those other supports as well.
What happens if someone might lose their NDIS funding, or it gets reduced when they have a plan review, which we know happens? So what is it, has that ever been an example? Or?
There has, and our model needs to, and you'll probably cringe when I say this word, but pivot in a way to be able to reduce, I guess, staffing down to an extent. There's no cross-subsidisation or anything like that.
Yeah.
And we haven't been in a situation yet, Kathy, where that threshold around being able to access that continual shared 24/7 support, people haven't gone beneath that. And
yeah.
Even if that did happen, we would work with the NDIS and the individual to ensure that they can maintain their housing, because they have a tenancy agreement, so that is predominantly they have that right to be able to stay there and it is their home. But what I probably didn't mention before is that the 24/7 support model, it's a sleepover model. So there's 16 hours of active support, and then that staff member is on call as well. But we are seeing some of our haven residences where that's actually increasing to 24/7 active because people have that within their plan.
Yeah. One of the questions online was, we know the Pathways to Community Living Initiative, another acronym, PCLI, here in New South Wales. How is it different? How is the haven different to that? I know the answer to this one, but you can answer this one.
Look, I think there's similarities. One, the NDIS isn't involved. It's a state government initiative within New South Wales, and it's probably been in the pipeline for, gosh, almost a decade now. I know there's been a number of delays for various reasons. But I think with PCLI, your criteria is that you'd needed to be in hospital for 100 days or more, and that was part of that pathway. That's not our criteria. People can come from all different walks of life and have varying levels of need. I guess the only eligibility is having an NDIS plan and being on the public housing wait list and having a psychosocial disability.
Fantastic. All right. Well, thank you so much, Sean. Please, round of applause for Mark.
Thanks, everyone.